Good morning, everyone, and welcome to today's press conference. I'm Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare. We're going to be sharing some critical information related to the COVID-19 pandemic and vaccine distribution within Munson Healthcare today. Joining me today will be Dr. Christine Nefsey, who's the Chief Medical Officer for Munson Healthcare, and also Matt Willey, who is the President and CEO of Munson Medical Center. Both of those individuals will provide some opening statements and remarks, and then we will have a Q&A session where we will be answering your questions. So it's my pleasure right now to introduce Dr. Christine Nefsey.
Thank you, Diane, and thank you all for joining us. We're going to start out today with some numbers. So if we'll go to that next slide. Thank you. So I think most of you are aware that we are actually doing a pretty good job in Michigan of flattening that curve. So we still see an increase in our number of cases on a daily basis. We are currently, for our region, at 18,165 cases of COVID and 356 deaths. But if you'll go to the next slide, our cases per 100,000 as well as our percent positive have gone down. And I'm very happy to report that we did receive our first doses of vaccine last week. We started our clinics on Friday and have been actively scheduling and vaccinating our healthcare workers for COVID-19. Go to the next slide. This slide shows that as of December 21st, we have scheduled and or given 2,227 of our employees with COVID-19. So that's very exciting news. And just to update, this first bullet says we are expecting to receive a second shipment, and I am happy to report within the last 30 minutes, we actually did receive our second dose of Pfizer vaccine at the medical center. We are expecting another dose to arrive in Cadillac as well this morning, and we have been notified that we will be receiving our first doses of Moderna vaccine across the system, hopefully tomorrow. Next slide. So just to review for people, we are being given some guidance from both the CDC as well as the state regarding how to tier out the vaccine distribution. So because we are receiving limited doses around the country, we are prioritizing certain people to receive the vaccine first. Currently, we are in what we're calling level 1A or tier 1A. That is all of our healthcare workers as well as our residents and staff of our skilled nursing facilities. The next tier to be vaccinated will be our essential workers. So these are folks in our education sector, our police, our firefighters, corrections officers, people that keep our roads open, transportation folks. That will be the next tier. And recently added by the CDC into that tier 1B were adults 75 years of age or older. So we will be coordinating with the health departments on how to reach that patient population as well. After those folks all receive or have ability to receive that vaccine, we will be moving into our other high-risk adults, so people over the age of 65 and or those people that have comorbidities that put them at more risk for COVID-19, and then we will move into the general population. Next slide. So a couple of things as we learn more and we get updated. There are a couple of adjustments to recommendations. So if patients have received COVID-19 convalescent plasma or monoclonal antibody, they should wait 90 days before they get the vaccine. However, if people have had COVID-19, either with symptoms or without symptoms, they can get the COVID-19 vaccine at any time. Our only request is, just like with any vaccine, if you are acutely ill, we would not recommend you get the vaccine. Certainly, if you are still ill with COVID-19, we would request that you not come into our vaccine clinic and wait till your symptoms are over, and then you can come get your vaccine. The other indication for waiting would be if you've received another vaccine for something, say your flu or some other vaccine. We would recommend that you wait 2 weeks before getting the COVID-19 between those two shots. And, you know, this is a 2-dose vaccine. It is several weeks apart, and then it takes several weeks for your body to fully mount a full immune response. So it's really important, as we are bringing this out just to healthcare workers, until this is really widely spread out and we have a large number of people immunized, we must continue to act. We cannot let our guard down. So even though people are starting to receive this vaccination, it's important that you continue to socially distance, keep 6 feet or more apart from people outside your immediate household. Be sure to always wear your mask when you go out and wash your hands frequently. It's now my pleasure to pass off to Matt Willey, who is the president and CEO of Munson Medical Center. Matt.
Thank you, Dr. Nefsi, and I appreciate everybody being with us this morning. Next slide, please. So I'm going to share a little bit of information about how are we doing in caring for our COVID patients. And so this is some information that we look at each morning. And the information on the screen now really shows the most current data that we have, and it's reflective of actually midnight, so not too long ago. So as you look at it, you can see the number of inpatients that we have at all of the hospitals throughout Munson Healthcare. It shows how many we suspect might have COVID. And then it also shows, since the beginning of the pandemic, how many patients have passed away, as well as how many employees have tested positive. And I just maybe want to call your attention to a couple of things. You know, the first is about 5 weeks ago, we started having COVID patients being seen at all of our community hospitals. And that was really helpful for a few reasons. The first is the fact that we saw this late fall surge. And so we were able to kind of handle that patient inflow better, knowing that more hospitals were able to care for those people. But the second thing is that we are now able to keep patients closer to home and within their communities. And so as of last night, you can see here in Traverse City, there was 43 inpatient COVID patients, as well as the numbers at the other sites. Next slide, please. What this though shows is over a period of time, and really since the start of the pandemic back in April. And a few things, in March, and a few things to highlight would be, the first is just the number of inpatients that we have presently, you know, shown over on the far right side of the screen, is significantly higher than what we experienced in the spring. So it's been very much a increase and a surge, and really we're at 4 or 5 times the number of COVID patients just since the beginning of November than what we had in March and April. And so, you know, you can see there was a large increase as we started the month of November. It started, you know, dropping off a little bit in the middle of the month, but then we saw that recent spike. And we believe that that is due to the, you know, multiple household gatherings that occurred during the Thanksgiving holiday. And so that really put additional strain on our system. Since that time, we are having a little bit of a reduction of our inpatients. So that is encouraging to see. But one of the concerns that we have is, as we go into Christmas and New Year's, that those multiple household gatherings may continue. And so we want to really emphasize with the community that it's important that we maintain those social distancing things that Dr. Nefsi spoke about, and that I will emphasize soon as well, because by having those multiple household gatherings, it does create the probability that we will have more inpatients, and that does put additional strain on our staffing resources and our ability to care for not just the COVID patients, but our non-COVID patients as well. We are, though, encouraged to see the recent decrease in our COVID population, and we do hope that that continues once we get into the new year as well. Next slide, please. So there's been a lot of questions from the community about how do we get vaccinated? And Dr. Nefsi mentioned that we now are beginning to vaccinate our providers. We are beginning to vaccinate our clinical team members. So we're really focused on that 1A, and we're making really good progress with it. So naturally, the question that people have is, well, when could I could potentially get the vaccine? And we're asking everybody to be patient. At this time, there is not the doses available to do that. And so when we do learn more, we will be able to share publicly how and where the general population can be vaccinated. Right now we do have limited information, but we are though getting a lot of questions from the community coming into our switchboard and asking, when is it going to be here? Or when could I potentially get the vaccine? And as a result of that, it's actually having those calling in to schedule appointments for their ongoing healthcare needs really have an impact on them getting through. So we are asking that the public, unless you are already scheduling for your preventative maintenance screenings or other needs that you have, that you hold off on calling Munson Healthcare in order to learn more about when the vaccine might be available, because it does impact those other individuals that are trying to get through. The best option would be to go to munsonhealthcare.org for all of those latest updates. And again, I will just emphasize, we will share broadly and widely once we learn more about when the community vaccination would be available. Next slide. This is some information that was previously shared, but given how important it is, we want to make sure that we speak to it again. So as we go into the holiday season, it's so important that we all keep our distance 6 feet or more from people outside our immediate household. As we think about what are the best ways to prevent widespread community passing along and having that next surge of inpatients, these would be the things that we can all do. Please make sure that you mask when you go out and washing your hands frequently. Munson Healthcare has a new marketing campaign that's shown there, that it's time to act, which is avoid COVID-19 today. All of us have the ability to have an impact on ensuring that we do not have that additional surge after the holidays. Next slide, please. We've spent a lot of time talking about how we are caring for our COVID-19 patient population. We also need to make sure that we talk about how we are caring for our non-COVID-19 population. At the medical center right now, we have an inpatient census of about 320 people, and roughly 40 of those are related to COVID. So we have 280 individuals just within our inpatient units of who we are caring for. And so it's important to know that throughout all of our community entities, that people should continue to seek care when needed, that Munson Healthcare is open, and that we are a safe place in order to go. Please make sure that you follow your physician's advice for those preventative screenings and appointments that are needed. And a lot of those are now being able to be accomplished through video capability. We really want to make sure that, as there are concerns out there, that people do not have kind of emergent needs that they prolong or they postpone, or that they don't act upon. So if somebody's experiencing chest pain, we want to make sure that they are not staying home, that they are reaching out to 911, and that they should feel comfortable knowing that they can come to any one of our facilities and be in a safe environment. We have sufficient PPE, that's personal protective equipment, such as gowns and masks and gloves, that will keep not only our patients safe when needed, but also our staff members that are caring for them. And so we have adequate levels of those. So again, really emphasizing that if you do have ongoing healthcare needs, to not postpone those and to reach out to us, because we're able to care for you in a safe way. Next slide. The last thing that I want to speak to is that, one of the values of Munson Healthcare is safety. It is a top priority of ours. And there is an external national organization called Leapfrog. And each year they look at different criteria for hospitals across the entire country. And we are very proud to know that Cadillac Hospital and Grayling Hospital just not too long ago received a safety grade of A from Leapfrog. We also want to highlight the work being done at Manistee and here at the Medical Center in Otsego for their grade of B. So all Munson healthcare facilities received either an A or a B from the Leapfrog. And those are all the eligible participatory hospitals that submit information. So again, just highlighting the fact that we are providing great care, and that the community should feel very comfortable for whatever healthcare needs we can assist with. Next slide. The last thing I want to do is just say thank you, and I believe Diane will take it over for some questions from the group. But I want to just give special thanks to all of the community members that have been providing support to our team members. And that's if we're in Cadillac or Grayling or Charlevoix, out in Frankfurt, here in Traverse City. The community support does such an amazing job of making our staff members feel valued. Each day we get different letters and cards and notes, and that they really lift the spirits up. You know, here at the medical center in the last 40 days, we've actually had over 4,600 meals that have been donated to our team members. We have over 2,000 cookies that have been delivered. It's from 30 local restaurants and different shops that are helping us out. And so whether somebody's in a clinical role or a non-clinical role, because of the fact we've had such support from the community, everybody's been able to benefit from it. So on behalf of all of Munson Healthcare, thank you for that ongoing community support. And with that, I'll turn it back over to Diane.
Great, thank you, Matt and Dr. Nefsi. And I couldn't reiterate Matt's sentiment on that more. It is just overwhelming to hear and see the support that all of our healthcare workers have received. All right, so now we are going to move into the Q&A session. If for those of you who are actually on the Zoom, we're also streaming this live on Facebook, and we are accepting some questions from our Facebook viewers as well. So the first question we have received is from a reporter, and Dr. Nefsi, this one is going to be for you. And we have already addressed how many employees we've been vaccinated. This question is specifically for one hospital, so I'll just let the reporter know that we will get that specific information to you via email after this call. We addressed when the next shipment was coming, but the third question is, are there any side effects that we're seeing among staff right now?
Yeah, that's a great question, and it's one that we've been really monitoring pretty closely. And all reports so far is that the side effects have been very mild. A couple of people saying they have a little bit of a sore arm. We did have one person that had what we call a vasovagal reaction, which some people commonly get when they get a shot. They don't like shots. They get a little sweaty, and that's, you know, not because it was a COVID vaccine, but because it was a needle and a vaccine and could have happened to anybody. But really, the side effect profile thus far has been really mild.
Great, thank you. And I have gotten that reaction before because I am really squeamish around needles, but I just want to reiterate, I have not received or been offered a vaccine yet. I'm not in that first tier yet, but I'm looking forward to when my time comes. The next question, Dr. Nefsi, could you just elaborate a little bit more on your slide that talked about the different tiers and who will be next from a Munson Healthcare perspective? And then could you also comment, there's a related question around how are the partnerships with pharmacies and health departments going?
Well, why don't we start with that one? You know, the partnerships are going really, really well. We meet with our health department colleagues around the region on a daily basis. So we have a vaccine steering committee. There are representatives from all of our health departments that come to that meeting, and we really are discussing and sharing information about, you know, who is on our list, who's on their list, whose responsibilities where. And so that partnership, I think, is working very, very well. I am happy to report that the health departments have also received their doses of both Pfizer as well as Moderna, and so their clinics are getting started in addition to ours. So I really anticipate that we will be able to bring vaccine out across our northern Michigan geographic area in a really good way. So those partnerships are working very well. And to address that first question about the tier. So we really are, as we look at our healthcare workers, trying to prioritize those that have the highest risk. So we really started out offering this vaccine to people who were taking care of COVID patients or could take care of them before knowing. So people in our emergency rooms, on our COVID floors, in our ICUs, that kind of thing. We have since that time opened it up to all of our inpatient clinical folks. We are in the process of bringing those out in batches, just so that they can get scheduled in a efficient way. And we would anticipate we'll be able to offer it to all of our healthcare workers, even those that may not be clinical but support the clinical staff by next week is the goal.
Great, thank you. And I appreciate our team bringing this slide back up because there was that change to the age 75 and older. Is there a reason why, do you know, that was changed, and how that might affect our population in Northern Michigan too?
Yeah, I think that's a great question. And I think that people in health departments and other places are really trying to find the right balance of getting high-risk people as well as, those essential workers that help keep our economy open, vaccinated. And so, the reason that our skilled nursing staff and residents were prioritized is because they had such a high mortality rate early on in this pandemic. And so they were considered, very much at risk. And, as we learn more about this COVID vaccine, one thing that hasn't changed, about COVID-19, one thing that hasn't changed is that our elderly population is very much at risk. And so I think that the health department just looked and said, the right balance would be to get some of those very high risk folks, so those people that are 75 years of age or older, as well as our more essential workers at the same time. So I think that's where that came from. And we are, again, working with the health departments. I know we've been talking a lot with our ambulatory medicine folks about getting those lists of patients, who they are, so that we can get ready to figure out the best and most efficient way to get that vaccine out to both essential workers, our teachers, our police and firemen, as well as those higher risk patients.
Great, thank you, Dr. Nefsi. Matt, this next question is for you. You touched on this a bit during your presentation about the calls that we're receiving from members of the community. Can you just speak to what are some of the common questions they might be asking, and if not, I can help add a little commentary to that too.
Yeah, I think probably by far the most common question is, when might I be eligible to receive it? And so again, that is something that as we learn more, we'll be sure to share that broadly through many different channels on our website and social media and print media and others. So that's the most common question. Some of the other questions have already been asked to Dr. Nefsi. What are some of those potential side effects? What are the pros and cons that are associated with it? There are some different patient populations where you might need to have a specific conversation with your physician about whether it's right for you or not. So those are kind of the right questions that people are asking, but it's more about, when is it going to be possible? Because obviously, not just within Northern Michigan, but across all the country, we're seeing such great news and seeing the vaccines being given to those so deserving on the front line. And so naturally, we have a thought of when it might be across a broader community. And we're looking forward to sharing that once we know more.
Thanks, Matt. And yes, again, we've tried really hard to have a pretty robust FAQ section on our munsonhealthcare.org website, and we will continue to update that as information changes. For example, I think the information that Dr. Nefsi shared about the age 75 years and older being moved up a tier needs to be updated on our website. So we're working as fast and furious as we can to keep up with all these clinical updates and keep the public informed. So that will be the main place where we will be distributing information, in addition to these press conferences, and working really closely with our really valued media partners to get this information out as more information becomes available. So back to you, Dr. Nefsi. We mentioned in your slide that we're expecting the Moderna vaccine to come tomorrow, which is really exciting, because I think I was even anticipating it might be a little bit more of a delay in that. But this related question is, have employees expressed a preference for one or the other, and will they be able to choose?
Yeah, it's a good question. We have not heard that people are expressing a preference for one or another. You know, I think really the convenience of getting it sort of closer to home or where you work is probably the thing that will drive it more than anything. The vaccines are very similar. They're both mRNA vaccines. They're both 2 doses. One is 3 weeks apart. One is 4 weeks apart. You know, the Pfizer one is authorized for 16 and up, and the Moderna is only 18 or up, but that does not affect our employees, not very many anyway. So, you know, not really hearing very much about preference one way or the other. I think the reason the state really made the decision about who gets Pfizer and who gets Moderna, one is the storage of the Pfizer vaccine is a little bit more complicated, and it's sent out in much larger dose amounts. So, you know, the Moderna you can get sort of 100, whereas the Pfizer, it comes in 975. And so if you're a smaller hospital or in a smaller community, your ability to go through that vaccine, if you have that much, is a little bit different than if you receive a dose of 100. So that's a little bit where that's coming from. I did also, just to add to your point, Diane, want to make sure everybody understands as well that, you know, a lot of the same information about how much vaccine we have and what and who the tiers are and all that is also on our partner health departments' websites. Lots of good information on the Michigan Department of Health and Human Services website. Very good information on both the Pfizer and Moderna websites. And again, we are doing our best to keep ours updated, but the health departments likewise have a robust amount of information on their websites as well.
Great, thank you, Dr. Nefsi. Matt, this next question is for you. Can you speak to some of the logistical challenges of receiving the first shipment of vaccine, and how do you think the teams, you know, did with getting it distributed as quickly as possible?
Yeah, you know, I think the receiving of it was actually done very, very well. Probably the most effort that took place in terms of how do we get the clinics actually set up. So once we have it, how do we get it out to the appropriate people? And so when we did have our first shipments arrive at the respective locations, we had a team waiting for people. We had already proactively purchased the freezers with the lower temperature capability. And so we were able to get the vaccines to our pharmacies relatively quickly, making sure that it was under the proper escort as well. But really, that's where a lot of additional work began. And we've been setting up a call center. So if you are able to get the vaccine, you call into a centralized location. That's for all of Munson Healthcare. And so we've actually been redeploying a lot of our team members to help with the scheduling. We've been redeploying a lot of our team members to help with the vaccine administration. And so there's a whole group of people across many different specialties and departments making that possible. So the real effort almost was in the administration of it, and that has gone very smoothly. And when you go to any of our sites and you see the folks that are getting vaccine, you see a lot of smiles in that room. So anyway, it's been very rewarding for everybody across the supply chain and implementation team to see it actually go into place.
Thanks, Matt. And we will be sharing a lot of those personal stories on our website as well, and through social media, because there's so many people and employees that have wanted to share why they want to get vaccinated. There was even a mother who works in our employee health department at Munson Medical Center who was able to give the vaccine to her daughter, who is a respiratory therapist. So just wonderful, wonderful stories coming out of this. So thanks, Matt. Dr. Nefsi, I don't know if you'll be able to answer this question, but I'm going to ask it anyway. It was for skilled nursing residents. How soon does the vaccine work, and are there projections for when that means visitors might be allowed in again?
Yeah, and those are kind of 2 different questions. So like we said, this is a 2-dose vaccine, and it takes your immune system probably about 3 weeks to mount a full immune response. So it really wouldn't be until 3 weeks after your second dose that we would say people are immune. Additionally, we've talked a little bit about herd immunity before, and it takes up to 70% of a population to be immunized before that herd immunity works. So, you know, that's why we are saying you need to continue to mask and socially distance and all of those kinds of things. The visitation for our long-term care facilities and those is really being dictated a little bit from the state, as well as other risk factors that are being involved. So, you know, that is, I think, a related but separate question. So we will look to continue to hear guidance about when some of those restrictions that were put into place about our long-term care facilities. I mean, they are being tested more frequently. There's a lot of different rules for them, just because of the risk and the degree of mortality we saw among that population. So I don't know a good exact answer to that. I'm sure it's something that's under consideration, but I would say until we can get, you know, large numbers of those folks immunized, those visitation restrictions will likely stay in place for a while.
Great, thank you for that answer. I have another question for you, Dr. Nefsi. This has been trending on a lot of the media today. We're hearing concerns about a new strain of COVID-19 and a mutation. Are we concerned about this, and are we responding to this in any way?
Yeah, that's another good question. So I think what people are referring to is there appears to be a mutation in the virus that was noticed in Great Britain that makes it quite a bit more easy to catch, I guess. So the good news is that it doesn't seem to have impacted the virulence or how sick you get, but it does seem to impact how contagious this virus is. So, you know, it's not a surprise that the virus is mutating. That's what viruses do. And the work that is going on right now is really an evaluation of whether that mutation is going to impact the efficacy of the vaccines we have in place. The preliminary data is that no, it won't, that the way that these vaccines were designed will still be effective in preventing COVID-19, even with that new mutation. But, you know, just like we have to get flu shots every year because that virus mutates, there is the possibility with COVID-19 that you may need booster shots or an adjusted COVID-19 vaccine as time goes on. We just don't know that yet. But preliminarily, it looks like the vaccines will work even with that new mutation.
Great, thank you, Dr. Nefsi. Matt, another question for you, and it's related to making the vaccine mandatory for Munson healthcare workers. And I can just comment on that, that at this time, the vaccine is not being mandated, partly because we don't have enough supply to do that just yet. And Dr. Nefsi, there may be some other reasons as well. But for Matt, are we hearing any skepticism among staff for getting the vaccine, and are we doing anything specifically to alleviate their concerns? And did we do any kind of readiness survey?
You know, in terms of how do we alleviate concerns, there's been a lot of education that we've been providing, whether it's Dr. Nefsi or other clinical leaders sharing it with staff so that people know the kind of the benefits and risks of whether they want to receive it or not. You know, I will share whenever I've gone to the vaccine clinic and I've asked people, hey, what are you hearing from your colleagues? What's their kind of willingness to have this? You know, overwhelmingly, there is a desire to get it versus a desire to wait and see. So I think that's very encouraging. I think for all of us that that people do want to participate in it. And as we think about long-term, making it mandatory or not, that is something that we would obviously have internal discussions on, but we would also have conversations with our peers and other health systems. We'll have better information at that time. We have a very close relationship with the State Hospital Association. But at this point, obviously it's voluntary, and there seems to be a big willingness and eagerness in order to get the vaccine.
Great, thank you, Matt. Dr. Nefsi, this next question is for you. A reporter is asking for a little bit of clarification related to last week's press conference. She thought she heard you say that full immunity would come 1 week after the second dose. And you said just now that it could be 3 weeks, but I think maybe you were talking about the entire length of between the first dose and after the second dose. Can you clarify?
Well, you know, it's one of those things where everybody's immune system works a little bit differently. So I don't know that you can say exactly 1 week after receiving your second dose, you will be immune. You know, this is your body must recognize the virus, create the response that it needs. So you know, those time frames are, with other vaccines, typically what we would see is after your second dose, it will take you several weeks to develop a full immunity. So I don't, I'm not sure where that 1 week part came from, but you know, it's a spectrum, just like with everything.
Okay, great. Another question for you, Dr. Nefsi, another clarification of who's getting the vaccine and those different tiers, but are staff members who may come into contact with COVID-19 patients required to get the vaccine?
Nobody's required to get this vaccine. Everybody's being offered the vaccine, and certainly we encourage it given the risk of their jobs, but it's not a requirement.
Okay. Also, Dr. Nefsi, another reporter is asking, we've heard reports that several states have had their expected vaccine totals cut by 30 to 40%. Has that impacted Munson Healthcare or the local health departments that you know of?
Not that I know of. We did also get similar reports, and actually the state of Michigan's for Pfizer vaccine was reduced by 29%. That does not appear to have impacted Munson Healthcare or our Northern Michigan health departments. But obviously, you know, we continue to monitor and continue to judiciously bring in our tiered providers based on their risk.
Could you also clarify sort of the distinction between who is Munson Healthcare responsible for vaccinating and who are the health departments responsible and the pharmacies? Because, you know, there's a lot of first responders or independent providers that may be, and we've been talking a lot about our own employees. So could you just clarify that a bit more too?
Yeah, so, you know, what we received from the state was that the hospital entities would be responsible for their employees and staff, and that the health departments would be responsible for, you know, kind of the healthcare workers that didn't fall under a hospital entity. That being said, again, we are coordinating very closely with our health departments to make sure, you know, that our EMS providers and other folks are on someone's list so that everybody has access to this. The stance that we have taken is that obviously all of our employees will get this, all of our providers that are credentialed and privileged to practice, people that are within our four walls, we will be getting the vaccine for. But again, we are trying to tier it for those sort of frontline patient-facing employees first, and then we'll kind of go down the list.
Okay, great. You know what? That was our last question that we received. So I'm not seeing any other questions coming in from social media as well. So I think that wraps up our session today. So I just want to thank everyone for joining us. We will again try to do these weekly to keep you updated. As you can tell, information is changing on a daily and hourly and by the minute basis at times. Again, encourage you to go to munsonhealthcare.org for the latest FAQs and the latest updates, as well as your local health departments, the CDC, and the Michigan Department of Health and Human Services websites. We are all coordinating as best we can to get the accurate information out as quickly as possible. And I just want to thank Matt Willey and Dr. Nefsi for joining us today. We will invite other speakers as we move through this pandemic together to provide different perspectives on it. But Matt and Dr. Nefsi, it was really great to hear your perspectives because many of the questions were directly related to your areas of expertise. So appreciate you being here today. And I just want to thank everyone else. And this session will be recorded and posted on our website if you'd like to view it at a future time. Have a great day, everyone. Thanks.
Okay.
Thank you, everyone.